like that, nutrition has to play into it. So this is just, 4 or 5 of some of the stones that are being moved right now that all will lead to nutrition being a bigger part of our healthcare system. I think where I can help on that is elevating the work that's being done, having conversations, again, across the whole medical community to help us in a really positive and unifying way move towards a more root cause approach to health.
You think that will be a hard item to push in our medical schools about nutrition?
I've
It
had
shouldn't be.
conversations with a number of deans of medical schools who are very, very passionate about this issue. They want to change. It feels hard because we have this behemoth healthcare system that operates a certain way. But right now, there's cultural momentum, there's political will, and I think the time is now to make generational changes that are going to have a huge impact on all Americans. And I also think it's an issue that all of us can work on together. It's non-controversial, it's positive, it's unifying, and I think that's what we need right now for Americans.
It's all about educating people, and sometimes people don't want to be educated, but I think the Surgeon General and our whole Department of Home Health and Human Services, I think everybody's on board with that. And if we do that, what Senator Sanders was talking about the $5 trillion a year we spend, we can't afford to do that anymore. I mean, we have to start, and the root cause is education. We have to educate people. Thank you very much.
Senator Baldwin.
Thank you, Mr. Chairman, and thank you, Dr. Means, for being here today. You spoke in your opening statement about building trust in public health. And you also made, I think, a passing reference to conflicts of interest within agencies in HHS. So I want to ask you a few questions on that point. Dr. Means, you've promoted a lab testing company, Genova Diagnostics, which is backed by private equity and may charge customers several $100s for its services. Before you began promoting their tests on social media, the company agreed to pay $43 million to resolve allegations that it had billed for medically unnecessary lab tests and violated the False Claims Act. You personally accepted $10,000 from this company, and I want to ask you whether you were aware of Genova Diagnostics' prior violations and the settlement when you started promoting their services.
Thank you, Senator Baldwin, and also thank you so much for meeting with me beforehand. I really enjoyed our conversation. Frankly, I was not familiar with that settlement.
So that's
there's a particular test that they make about nutrient quality that I find very compelling, because I do think we need to understand a little bit more transparently about how the nutrients from our food are affecting our health. And I would just highlight that I have worked extremely closely with the Office of Government Ethics over the last several months and taken this process very seriously. I've signed a letter that outlines how to rectify any potential conflicts. And I
know you're going to divest your
absolutely
stocks in all sorts of health-related and non-health-related entities, but it's troubling because the Surgeon General must be someone that the public can trust, and someone who does their homework before accepting money or lending credibility to a company. And for me, this raises questions about your judgment. It does not inspire confidence that you're here to make Americans healthy when you accept money to promote a company who's had to pay a settlement because of violating the False Claims Act. Dr. Means, you have also promoted a range of supplements, including those that claim to promote longevity and detoxification. You made at least $325,000 from promoting supplements since the beginning of 2024, according to information provided to this committee. This includes nearly $135,000 for a so-called longevity supplement and $46,000 for wellness teas and elixirs, both of which can cost upwards of $100 a month for somebody consuming them. Your company, Levels Health, offers continuous glucose monitoring, and AI-driven health insights. And a full membership, and I'm not sure what all a full membership involves, but costs $1,500 a year. And that's about a whole month's average rent for a one-bedroom apartment in Milwaukee, Wisconsin. So do you really believe that most Americans can afford to spend upwards of $1,500 a year on your supplements and programs? And is that one of your solutions to our nation's health problems?
Thank you for the question. I certainly don't think every American needs to be wearing a glucose monitor. I think that we have a monumental blood sugar problem in this country that underlies most of the leading causes of death in this country: dementia, cancer, diabetes, heart disease, stroke are all connected by metabolic dysfunction, elevated blood sugar. And my work on using entrepreneurship as a tool to bring and study new tools that can help us understand our blood sugar better, I believe I'm very proud of. And as I mentioned in my opening statement,
Thank you for
Yeah.
that statement and those observations, Dr. Means.
And that
You say
research
you
that we've
want
done
to
with the company
address.
is meant to benefit all Americans.
Yeah,
It does
and
not
that's what I
necessarily
want
mean
to
that
tie up
every.
in my remaining 12 seconds. Dr. Means, you say you want to address chronic disease, but 1/3 of low-income adults have 2 or more chronic conditions. They need an affordable solution. Groceries are too expensive. Healthcare is too expensive. Health insurance premiums have skyrocketed because of Republicans' refusal to extend the tax credit and cuts to Medicaid. 15 million Americans are losing their health insurance. People cannot afford their prescription drugs. So you've said that our healthcare system is broken, but it seems to me that you've spent your career sort of making money off the flaws in the system. And I'm left wondering how the American people are supposed to trust you to put their health and safety first, not profits.
Those are incorrect characterizations. I appreciate your comments, and I do look forward to working with you and on your priorities. And I absolutely am committed to giving Americans the best public health information possible. And like the comments I made prior, I think some of the movement in our administration towards making healthy food more accessible are going to impact all Americans in a very positive way. And I look forward to helping on that and many other issues that make healthcare accessibility much easier for all Americans.
Senator Husted.
Thank you, Mr. Chairman. Dr. Means, thanks for being here today. I'm going to try to get through pesticides and mental health for our children, if I could. I want to thank you for what you're trying to do to raise awareness about healthy eating, healthy foods. And since your nomination, though, I've had a lot of questions from farmers in the agriculture community in Ohio about your comments on pesticides. And you will not regulate pesticides in your role, but your views will impact American consumers and what they believe about what's healthy and good for them. What is a pesticide? I would just put a little poster up here, and why do we use them? Because this is the kind of thing we try to prevent. This is an earworm. This is the kind of thing that destroys our crops in all across the country. Corn, wheat, soybeans, fruit, and vegetables. If we fail to use proper pesticides, it will drive down yields of 20 to 50%, even more for fruits and vegetables, the very things we want people to eat more of, which will restrict the supply chain, make food less accessible and more expensive if we can't have proper crop yields and use more land, more resources, et cetera. And so given all those facts and given what the concerns are, please just share your views on pesticides for what they mean to the average consumer of food in our grocery stores.
Thank you, Senator Husted. And thank you so much for meeting with me prior to this hearing. This is a very complex issue. And what I would just want to start by saying is that I have the utmost respect for the American farmer. And I think just like doctors, farmers are in an impossible situation right now. Where we have developed an agriculture system that is dependent on chemicals that are toxic to have an affordable food supply. And that's not good for farmers. It's not good for consumers. It's a complex issue. And obviously, changing anything overnight would be devastating to the American farmer and the American consumer. With that said, this administration is committed to understanding what's in our food and how it's affecting our bodies and how cumulative exposures to various chemicals in our environment is affecting us. And that is a core, profound, long-term, deep passion of mine as someone who thinks about how our environments and the system that we live in is affecting our health in the midst of this monumental chronic disease epidemic. And certainly pesticides, herbicides, insecticides is something we need to look into as part of that cumulative exposure. So it's a complex issue. It's very sensitive for farmers and for American consumers, especially mothers, because we want to have the safest water and the safest, food supply in terms of what's on it. But I understand the nuance of these issues and that changes need to be made thoughtfully with full respect for American farmers and the constraints that they're under. And also, eventually, we are going to need to move towards a more sustainable way of growing our food that decreases our reliance on toxic chemicals that are hurting human health. I think there are incredible movements happening within the administration. Like I mentioned, the $700 million going towards regenerative agriculture transitions, precision agriculture, and the private sector collaboration that may be using technology to help be more precise with pesticide spraying. And I think those are all positive developments. But at the end of the day, we do need to understand how these chemicals are affecting our bodies and work towards creating the safest
Great.
food system.
I have one more, three quick questions for you. It's on mental health of our children. And I'm going to ask all three of them to give you a chance to respond. Do you believe that smartphones and social media are negatively impacting the health of America's children? What age should a child have access to a smartphone and social media? And what would you recommend? Would you recommend banning smartphones in America's schools?
I believe that the research is showing that the impact of social media on children is profound and negative, and we need to take great efforts to protect children from premature use of technology that is associated with mental health issues and depression, and it's a strong concern of mine.
And what age does the research say that we should have, give child access to a smartphone?
I don't have the answer to that question. I don't know if that an exact number is known, but I think in light of how quickly things are moving with technology and social media and how rapidly things are changing, we need to, as parents, communities, schools, and a government, exert an abundance of caution and be very proactive about making sure we're protecting children and their mental health.
I hope you'll spend some time talking about this issue in your role as Surgeon General, because if you go to a school that's banned smartphones, they will tell you it has a profound difference on the mental health and the educational environment in those schools. So thank you. For being here.
We'll now go to Senator Murphy, and for the awareness of the members, after Senator Murphy, we'll take a 15-minute break for the benefit of Dr. Means, and more importantly, the benefit of her child, and then we'll return 15 minutes, as said.
Thank you, Mr. Chairman. Good morning, Dr. Means. Dr. Means, are you familiar with FTC policy that requires those who are recommending products online to disclose their financial connection to those companies? In particular, the document from the FTC says this: if you endorse a product through social media, your endorsement message should make it obvious when you have a relationship with the brand. Are you familiar with that?
Certainly.
As you know, there is a pending complaint regarding your failure to adhere to those guidelines that basically makes the contention, and this committee has verified the data that underlies their complaint, that you routinely violated this policy, and that in fact, in the majority of your posts for many of the products you recommend, you did not transparently reveal your financial connection. Let me give you an example.
That's false.
Well, I'll give you an example. So there's a prenatal vitamin called WeNatal. Your filings before this committee show that you started receiving compensation in the spring of 2024. And yet in September of 2024, you posted a video saying that you had no financial relationship to the company, just a big fan. And then in October, you said, not sponsored, just love these. But in fact, you have documentation before this committee that showed when you said those things, you had a financial relationship. You had already started receiving money from that company. So you weren't telling the truth when you said you were just a fan. You were actually receiving money, correct?
If I, in any post where I said I am not receiving money, I had not been receiving money at that time.
But you had received partnership fees for this particular prenatal vitamin. In fact, prior to September and October, you had posted partnership links in which you get compensated based upon click-throughs, correct?
I'm happy to look at whatever documentation you're talking about, but I do not, it's incorrect and it's a false representation. And just to be very clear, I've spent the last several months working with the Office of Government Ethics to be fully compliant with this process. I take it very seriously. Before, during, and after, if I am in office, I will be in full compliance with the Office of Government Ethics. I think, as I've talked about, conflicts of interest are incredibly important to rectify if we're in public service, and I am fully committed to continuing to work with them.
So let me give you some other examples. Function Health, which is your lab testing platform, data shows that you disclosed your partnership with them less than a third of the time that you recommended their services online. Genova Diagnostics, you disclosed your sponsorship in only 2 of the 9 times that you promoted Genova. Daily Harvest, you disclosed your sponsorship in only 3 of the 14 posts recommending that product. Zen Basil Seeds, you disclosed your partnership only 2 out of the 13 times that you recommended the product. This seems systemic. It seems that in the majority of instances in which you were, as a medical professional, recommending a product, you were hiding the fact that you had a financial partnership. You seem to be in regular willful violation of the FTC rules. That is concerning as someone who agrees with Senator Cassidy that our focus has to be on restoring trust in the medical profession. And yet over and over again, you seem to be at scale recommending products without telling your followers. And you have 200,000 newsletter subscribers. You have almost 1 million Instagram followers. And in only 3 out of 14 times on Daily Harvest, when you were promoting Daily Harvest, you disclosed that you're getting paid by them?
It sounds like you have a lot to say about this issue, and I would be very interested to see how your staff looked at this data. I have a strong feeling that the way in which they gather this data is done intentionally to create these claims that you're making.
Well, I have the backup here. I mean, will you acknowledge that in many instances when you were promoting these products, you did not disclose that you had a financial relationship?
I don't think that's true. If it has happened, if it inadvertently has happened, I would rectify that immediately. However, I would be interested to see how your staff gathered this
I'll be
data.
happy to send it to
And
you.
I will conclude by saying
I'll
that
send
I
it to
take
all the committee
conflicts.
members. I mean, it's pretty incontrovertible evidence.
I take conflicts of interest incredibly seriously. I've worked diligently with the Office of Government Ethics to make sure that conflicts are addressed thoroughly.
The committee will stand in recess for 15 minutes.
Thank you.
Thank you for everybody being back. Senator Marshall defers to Senator Collins.
Thank you, Mr. Chairman. Welcome, Dr. Means. Addiction and drug overdoses are a major problem for families and communities in my state of Maine and across the nation. I'm concerned that in your book on good energy, that you urge readers to consider psilocybin-assisted therapy. You also said that you were inspired to try psychedelics in what I can only describe as an internal voice that whispered, "It's time to prepare." Illicit drug use remains a huge problem in this country, and this didn't happen in your teen years. According to your book, in 2021, you began using illicit psychedelic mushrooms. So my questions to you are twofold. One, do you stand by what you said in your book, encouraging people to try psychedelics? And second, as Surgeon General, should you be confirmed, how would you speak to the American people about the use of illicit drugs?
Thank you so much, Senator Collins. And I also thank you sincerely for engaging so deeply with my work and learning about me. This is a very important question. And I would start by just saying that I believe what I would say as a private citizen is in many cases different than what I would say as a public health official. Joining a team where the purpose of this role is to communicate absolutely the best evidence-based science to the American people to keep them safe, thriving, and healthy. And when it comes to psychedelic therapy for mental health issues, I think the science is still emerging. And so it would certainly not be a recommendation to the American people to do that under no circumstances. I do believe that there is exciting work being done in this area that needs to continue on psychedelic therapies for PTSD and veterans, for mental health issues. And some of the researchers who are doing this work have said it's some of the most promising and exciting of their entire careers. So I look forward to following that. But to be very clear, under no circumstances would I recommend that to the American people in this role. Our illicit drug use problem in our country is monumental and severe. And I look forward to working with you on these issues that are so important.
What did you mean by saying that you heard an internal voice whispering to you saying it's time to prepare?
Yeah, in that passage of the book, I'm referring to my mother's passing, which happened. She got a diagnosis of pancreatic cancer about a week after that experience. And in my meditations and prayers at that time, I was having a deep sense that something ominous was coming. And so that's what that's referring to. I think when I speak of spirituality, and I do believe Americans are ready to hear about spirituality as it pertains to medicine. 80% of Americans are spiritual or religious. There's amazing evidence coming out of Columbia University, the lab of Dr. Lisa Miller, that spirituality has a large impact on health outcomes. And, so certainly that's a personal anecdote. But I again am committed to sharing only the best solid science with Americans on how to be healthy.
I understand totally what you're saying about spirituality, and I'm sorry about the loss of your mother. It's the link to illicit drugs that I'm having a hard time with. But I have very little time left, so I want to go to another issue, and that is in the staff interview when you were talking about wasteful spending. You referred specifically to money that NIH spent on Alzheimer's research that, quote, proved to be fraudulent. And you were referring to the amyloid plaque research replication issue that was discussed in the New York Times. That story, however, has been largely debunked and countered. So I just want to make sure that I know for certain whether you are for vigorous research on looking at a wide variety of factors when it comes to Alzheimer's disease and other dementias.
Unquestionably, full-throatedly, yes. This is one of the most devastating diseases facing Americans today. It's one that I'm very passionate about, particularly in light of research showing that early onset Alzheimer's dementia in as early as the 50s is starting to rise at a significant rate. I believe that we need to be studying, like you said, all the different medical, genetic, lifestyle, environmental factors that can be contributing to this. And when I look at the research that, some of the research that I'm very excited to elevate in the conversation, if I'm confirmed, I'd point to the Lancet study from 2024 about the modifiable risk factors for Alzheimer's dementia, which I'm sure you're familiar with, which showed that with 14 modifiable factors, we could reduce 45% of Alzheimer's dementia cases. This is incredible. This isn't really the type of research that we've been hearing from the medical community. We hear a lot about drugs. We hear a lot about interventions that slow decline once we're sick. But that's the type of research, like from the Lancet, major medical journal, that I really look forward to elevating and supporting further research like that can really help Americans be empowered to prevent this disease when we can.
Thank you.
Senator Kim.
Thank you, Chairman. Thank you for coming out, and congratulations on the new baby. I wanted to just ask you about the role of the Surgeon General, the different aspects of it. So one of it is about issuing public health advisories, is that correct?
Yes.
I wanted to just ask, are you currently able to write prescriptions for patients?
I have not been seeing patients over the last several years, and so I currently, with the status of my license that I voluntarily put on an active status, which I'm sure what you're getting at, cannot prescribe a prescription right now. However, if I were to work with the Oregon Medical Board to reinstate that, it's very possible to do. And
is that something you're planning to do?
I'm not planning on prescribing prescriptions
no, I mean,
to Americans.
But are you planning to reactivate your license?
My path in medicine, I spent 4 years doing surgeries and seeing patients in clinics, and that one-to-one medicine, it's valuable, but my path took me down a different road to have a one-to-many approach to affect the root cause of why we're sick in America. And I've had a very successful.
So you're saying you're not going to pursue reactivating your medical license in taking this job? Is that correct?
I do not plan to reactivate because I'm not going to be seeing patients in this role.
So
it would not make sense to do that. In fact, for physicians, if I could just clarify, because this has been a point of severe misinformation from the media, for any doctor in a state where you are required to put your license on inactives if you're not seeing patients, I would imagine that many physicians in public health service who aren't seeing patients would have to put their license on inactive status because they are not seeing patients unless they choose to continue to do so while in office.
So another important role here, I just want to kind of clarify, because you're saying, you're not currently able to practice medicine. You're not currently able to write prescriptions because you're saying you're not going to be seeing patients in this job.
And I do have a medical
another
license
big role.
right
another
now.
big role of the work that you're doing is to be a leader of the Commission Corps.
Yes.
Is that correct? So I guess I wanted to just dive into this because, with the Commission Corps, it's saying as a Commission Corps officer of the U.S. Public Health Services, keeping professional licensure and certification up to date is mandatory. So I guess I just wanted to get a sense of how you're squaring this here.
Well, I do have a medical license right now. It is voluntarily placed on inactive status because I'm not actively seeing patients at this time. The HHS and Admiral Brian Christine have testified in front of this committee that I am eligible to serve as the medical director of the HHS.
But how does that square
And
with
I'm the
saying here it
president's
says
nominee.
keeping a professional licensure and certification up to date is mandatory? Is yours up to date?
I have an I have a medical license that is unexpired right now. Admiral Christine has testified that I'm eligible to serve in this role. I'm the president's nominee for Surgeon General, and further questions about that will have to go to
So
them.
if we were to expand that, would you say that like with the others in the commission core, do you think we should remove the mandatory licensure for them to be able to participate in the core?
That's not a question that I've considered. I don't think it's actually relevant to this particular hearing.
Well, it's relevant insofar as I'm just trying to think through if you're in this job, how are you going to be proceeding, and what kind of advice you're going to be able to give to the American people and the credibility that they will have in understanding what your advice is. Also, in terms of, if you are a leader of the commission core, I'm trying to get a sense, are you going to deprioritize having an active license in the same way that you believe that you can do the job of a surgeon general without having an active license? Do you believe that that is the case for others in the commission core, that they can do their job without having an active license?
Senator Kim, I'm a medical doctor. I graduated from Stanford University School of Medicine. I have a medical license. My professional history is a feature, it's not a bug. I have had a unique history that has merged entrepreneurship, public health advocacy, faculty, course direction at Stanford University, as well as being an editor of a medical journal and a biomedical researcher. And in these complex times for American healthcare, that type of multidisciplinary history is going to be extremely valuable for the American people.
I don't discount your accomplishments and your education, but what I'm trying to get a sense of here is your ability to be able to engage with our current medical professionals, to show respect to.
I practiced medicine. I owned my own medical practice, and I've seen thousands of patients, and I did over 4 years of surgical training, which is more than many of our past surgeon generals completed who did medical specialties. I have completed extremely thorough medical training, and I have the ability through these experiences to communicate excellent public health information. And I really look forward to working with the Commission Corps. This is an incredible group of people, 5,000 uniformed officers who are committing their lives to helping the American people. And personally, just to share a little bit of a vision,
I agree with that.
a vision for
the
that.
signal that is being sent is one that I think we have to look at. And with that, I'll yield back.
Could I?
Yes, ma'am.
This incredible group of officers has traditionally been deployed for public health emergencies like natural disasters and infectious disease. And I think there's a huge opportunity to actually work with these members who are interested in approaching the chronic disease epidemic, which has not traditionally been part of their role. And I think that bringing that perspective and the demonstrated history of work in this area is actually going to be a really positive development for the Commission Corps. And I thank you for your questions.
Thank you.
Dr. Means, I should have said this earlier. Is your family behind you?
Yes.
Would you please introduce?
I'd be happy to. This is my stepmom, Kathy, my dad, Grady, my incredible better half and husband, Brian Nickerson, my best friend of 20 years, Fiona Biles, my sister-in-law, Leslie Voorhees, and somewhere in here is my brother, Callie, and also my cousin, Fleet White, and his wife, Adrian, I don't think is here, but yes. So,
well, I couldn't help noticing how proud the people looked behind you. So I said, let's put two and two together. So anyway, thank you, and thank you all for being here.
Thank you. Thank you very much, Senator Cassidy.
Senator Marshall.
All right. Thank you, Chairman. Before I begin my questioning, Mr. Chairman, I ask unanimous consent to submit this statement from Stanford School of Medicine supporting Dr. Means' nomination and recognizing her as an outstanding student to the record.
Without objection.
Dr. Means, do you have a medical license?
I do.
Thank you. Just wanted to make sure we clarified that as
Had
well.
one for 11 years.
Exactly. Dr. Means, there's so many things that you could focus on. Narrow it down to what would be, if you could accomplish one thing, what might it be? And so it's hard not to get into 2 and 3, but just share a little bit what's on your heart and your goals. What's your mantra going to be?
Thank you. Thank you, Senator Marshall. My dream for this role is first and foremost to help nudge, push, inspire our healthcare system towards focusing on root causes and the reasons why we're getting sick moving towards a real healthcare system and not just a reactive sick care system, which is, of course, also going to lower costs monumentally and unburden, I think, American taxpayers and doctors. I want to see affordable, accessible, real, nutritious food for all Americans, because we know that nutrition and food is one of the key, most important drivers of chronic illness or of health. And we're not eating real food. We're eating 70% ultra-processed food right now, and there are structural barriers to making that possible that good policy and reform in the healthcare system can fix, and I believe there's political will and cultural momentum to do so, and I look forward to being a leader in that. And I would say, lastly, a key passion of mine is to understand how the cumulative burden of the exposures we have in our environment across food, water, air, soil, the products we're putting in and on our bodies, how these are affecting our health. We know that these diseases are going up rapidly, and of course genetics have not changed over the past 20, 30, 40, 50 years. It's environmental exposures that are making us sick, and we have not prioritized studying that. And the NIH and the MAHA movement is focused on looking at this, and I think this is going to be a rapid accelerant of understanding why we're sick and how to heal.
Great, thank you. You and I are both concerned about the mental health epidemic, but especially in our youth. And I'm not expecting you to commit to this today, but at least to seriously consider what type of warning label we should put on social media and at what age. You know, we have tobacco warnings that it could be hazardous to your health, that alcohol could be hazardous to your health. In my humble opinion, social media for all of us, but especially young minds, can be hazardous to your health. So I'm asking you if you would just consider putting some type of a Surgeon General's concern about social media for especially our young adults, teenagers' health.
Thank you. This is an area where I believe the last Surgeon General also did incredible work. And, you know, obviously researchers and thinkers like Jonathan Haidt are doing great work on this and getting really the message out there into culture of the problems. And I am committed to working with you and truly anyone within the medical establishment, the tech world, and the government to make sure that we're protecting children from harms of social media and of excess screen use. You know, when we think about the world we want to see for our children, I think all of us know that we want to see our children outdoors, feeling safe, playing in the sunshine, joyful, interacting with other children, thriving, playing, and that's the world that I vision for my child and for all American children. And I think part of getting to that vision is making sure that we're being very judicious about how we address digital technology use. And of course, making sure that children are prepared, you know, to use technology thoughtfully and responsibly, but making sure that when there's evidence showing, which I believe there is, that social media and premature use of these programs is hurting their mental health, that we take action on it.
Thanks. Let's talk about nutrition for a second through your eyes. I think we all acknowledge that America needs to eat better, but not everyone can afford to go to Whole Foods.
Right.
Carbohydrates are cheap. Processed foods are somewhat, you know, typically cheaper. But how do we help the masses?
This is the most important question, because obviously if it's not the easiest and the most accessible choice, it's not going to be sustainable for all Americans, which is what we need. This is why I'm so supportive of some of these systemic changes that are happening. So the Dietary Guidelines for America, like I mentioned, just by changing that and calling out no more ultra-processed foods full-throatedly, which is what they did, this is going to feed into billions and billions of meals per year of changing procurement towards local, organic, whole foods for kids, military, prisons, hospitals, organizations that are getting federal dollars. So that's going to make billions of meals more accessible for people through federal dollars. Additionally, with the GRAS or the GRAS loophole that the FDA is addressing, Dr. Marty Makary, this is going to mean that we can't even necessarily put some of these chemicals in our food. And then at the NIH, they are going to be studying this more thoroughly. And so I think altogether, this is going to trickle into a safer, healthier food system for Americans that's going to be more affordable. I would also just mention SNAP. The reforms to SNAP are making these federal dollars go towards healthier food. And I think that's going to have a huge impact on actually getting healthier food to low-income communities, because if the dollars are flowing there towards healthier food, the brands and the companies are going to bring their food there.
Thank you, Dr. Means. I look forward to supporting your nomination. Thank you so much, Mr. Chairman.
Thank you, Mr. Chairman, and thank you so much, Dr. Means, for being here, for your family, and congratulations on the birth of your son. If you are confirmed, you know that you will be America's top doctor. And as such, people will be looking to you for scientifically accurate health guidance. So I wanted to drill down a little bit more to understand your views on vaccines and the science supporting Secretary Kennedy's vaccine vision. And I know you said earlier that this really isn't a part of your core message, but I know that you've talked about it before, whether it's on podcasts or in on articles or tweets. And so I just wanted to drill down a little bit more on that. And I know previously you stated that hepatitis B vaccine, giving it to a baby born to hepatitis B negative parents, is absolute insanity. And I think you did an analogy to it being criminal. I was really pleased to hear you say so strongly here today that vaccines save lives, that you support the vaccinations for children. And so my first question is, if a mother is hepatitis B positive, is providing the vaccine at birth, the most effective way to prevent transmission to the baby. So again, if a mother is hepatitis B positive, is providing the vaccine at birth the most effective way to prevent transmission to the baby?
I believe certainly that is the most effective way. Again, I would just say, obviously the patient should talk to their doctor, but yes, that's a pretty clear case where certainly that would have a huge impact.
Thank you for your response. It appears, even as we're talking about the Secretary's vision for vaccines in this country, that he has basically searched the globe to find things to justify his harmful, unpopular vaccine policies. And just a few weeks ago, we had Dr. Bhattacharya here, the head of NIH, and we got into a dialogue, even with the chairman, about using Denmark as our peer to make these kind of decisions. On December 18th, 2025, the CDC announced funding for a study in Guinea-Bissau, a West African country with just over 2 million people. The CDC-funded study proposed withholding the hepatitis B vaccine birth dose from half of the newborn infants in the trial without screening all mothers for hepatitis B. And as you know, as a doctor, that when babies are exposed to the virus at birth, they can face very high risk of liver damage or cancer later in life. So as a doctor and as a mom, would you agree that it is unethical and dangerous to withhold a life-saving vaccine from babies at risk of a preventable disease?
These are obviously extremely important issues. I am not familiar with the announcement that you just talked about.
But hypothetically, just as a scientist, is it unethical to withhold life-saving vaccine for a baby?
I think that in the case where standard of care is to give a vaccine, and that's the gold standard, I have trouble imagining a scenario where a study would be able to withhold that treatment.
Right, because when
But again, I'm not familiar with the study that you're talking about.
Yeah, and again, study is out there, but when a safe, effective vaccine is available, I think not just as a doctor, but as a human, we want to make sure that
I don't believe that Dr. Jay Bhattacharya or the HHS would be interested in withholding.
so we'll make sure you get the study, because what's interesting is that the researchers are also Danish, which is kind of interesting to me.
And also,
As-
sometimes the devil's in the details, and I think I would want
But
to
as-
look into this myself.
But as Surgeon General, it would be your responsibility to act legally and ethically. So you might oversee comprehensive scientific reports and oversee the commission core who will conduct research and care for patients throughout the world. Would you advise against a study or refuse to conduct a study with serious ethical implications, even if the secretary or the administration pressured you to?
Certainly, as a physician, as a person, as a mother, ethical concerns are of top priority to me. Protecting patients, protecting children. I am a strong-willed person who has no problem having direct conversations with anyone, and I would not hesitate to have direct private conversations with anyone about ethical concerns. And also, I do not believe that the secretary or anyone in the administration would ask me to do something unethical.
Well, we'll follow up with you on that particular study. I thank you so much for your indulgence, Mr. Chairman. And this is a vital kind of question for the foundation of this position. So thank you, and I yield back.
Thank you, Mr. Chairman. Dr. Means, the Surgeon General is first and foremost the chief spokesperson for Americans' health. Wouldn't you agree? You would be the first MAHA Surgeon General. What is the public not hearing that you're uniquely qualified to communicate to them?
Well, first I would say that I think that for anyone who has not read the MAHA strategy that came out at the end of last year, it's a document that everyone should read because it outlines an unbelievably positive, comprehensive, forward-thinking way of addressing the root causes of why we're sick. It's a profound document. I think it's groundbreaking. And many of the pieces from that strategy document are already way out of the barn, and wins are happening already that are going to make healthcare and food more affordable and accessible for all Americans. And so I'm just very supportive of the work that's being done, and I do think it's a huge sea change shift from what we've heard from prior administrations in my lifetime, or at least since I became interested in the biomedical sciences. When I was 20 years ago. I have not heard at the federal level this sort of just impassioned, brave approach to talking about busting through, industry, potentially conflicts in our research, the corporate capture of our agencies, and our health organizations, and just saying we're not going to stand for this anymore. We're going to put American health first, and not just in a reactive way, but in a proactive way. So all that is to say that I think we're going to see monumental progress over the next several years. And my deep hope is to be a unifying, practical messenger that brings people together around issues that I think every family cares about. There's not a person in this room who doesn't have a family member or a friend or know a child who's dealing with a chronic health issue. And we know that our environment is contributing to these, and we need to make it systemically and structurally easier for people to be healthy in this country. And that's what
When I read the MAHA strategy as articulated by President Trump and Secretary Kennedy, I mean, these aren't partisan themes or strategies. I mean, these are ideas that are broadly supported by the vast majority of Americans, right?
Yes.
Yeah. You've raised awareness about metabolic syndrome, how diabetes, stroke, heart disease, and their risk factors interact. What do people need to know about metabolic syndrome, and why isn't our healthcare system preventing these diseases?
Thank you for that question. This is one of my favorite topics in the world. So metabolic dysfunction and metabolic syndrome is referring to, not to get too technical here, but fundamentally it's the way our cells make energy and power themselves. We have trillions and trillions of cells in our body. They all need energy to work properly. Without that, we'd fall apart. Unfortunately, the vast majority of American adults now have metabolic dysfunction. By some studies, 93% of Americans, adults, have at least one biomarker of metabolic dysfunction, meaning there's this fundamental whole body cellular energy production problem that we know is deeply related to our diet and our lifestyles that then underlies diseases emerging all over the body, things like dementia, cancer, chronic liver disease, diabetes, obesity, heart failure, heart disease, stroke, et cetera. And so this is this systems biology approach that I'm talking about, that our healthcare system is not currently incentivized to look at the body as a whole system. We have over 100 medical and surgical subspecialties, and they are incentivized to look at one small part of their body. We need to bust that open, look at the body as a system, take the latest research on this unified sort of approach to health, and then start to transform clinical practice into that way. If we do that, we can help people earlier understand what's going on in their body and hopefully prevent some of these catastrophic diseases as people get older.
But
So
there's nothing partisan about that, right?
no.
Yeah, I didn't think so. Something else I don't think is partisan. You've been outspoken about the infertility crisis in America. More and more couples have trouble conceiving as so many women struggle to have healthy pregnancies. Why is that?
Yeah. So infertility is going up in our country. Male and female infertility, it's going up about 1% per year. Up to 26% of women globally have a type of condition that can lead to infertility called polycystic ovarian syndrome. This is a disease I'm very passionate about because it actually goes hand in hand with metabolic dysfunction. There's certainly genetic aspects to it, but many lifestyle features as well. Right now, the current standard of care for PCOS is to prescribe medications for the metabolic dysfunction and for the hormonal imbalances. But what the research has actually showed us, good research, is that very targeted interventions on our diet, for instance, there's a particular study I'm thinking of that did a ketogenic Mediterranean diet, and about 16 weeks, nearly all participants in the study reversed their PCOS markers just with a dietary intervention. That's one study. I'm not saying that should be the gold standard. However, this is not information we're hearing. It's not information we're giving to women in OBGYN's office. And I think that's really something we need to change. We need to give people empowering information about how to take their health.
Thank you. My time has expired.
For the record,
sorry.
no problem. And I'm just being a little heavy because we're running out of time. And for the record, what Blunt Rochester was bringing up was a CDC study by press reports which bypassed the career scientists but was pushed by the director's office. It was later suspended because Guinea-Bissau said it was unethical, at which point the Trump administration pulled it back. So just for the record. And next will be Senator Kane.
Thank you, Mr. Chair. Thank you, Doctor. In a news report on January 7, just a month or so ago, Secretary Kennedy stated, quote, "There is no evidence that the flu vaccine prevents serious disease or that it prevents hospitalization or deaths in children." Do you agree with that statement?
Senator Kane, as I've said, I believe vaccines save lives and are an important part of our.
But I'm not asking about the general. I heard that testimony earlier, but the statement is there is no evidence that the flu vaccine, and I want to be scrupulous about this, prevents serious disease or that it prevents hospitalization or death in children. You're an MD, your qualifications have been much discussed earlier. Do you agree with the statement that there's no evidence that the flu vaccine prevents serious disease or that it prevents hospitalizations or death in children?
I have not personally seen that quote or that article. I would want to review it before I comment on that.
Okay, I'm gonna set the quote aside. I'll introduce for the record an article, CBS News. RFK Jr. says it may be better if fewer children receive the flu vaccine, dated January 7, 2026.
Without objection.
Let me set aside the quote and set aside Secretary Kennedy and set aside the article. Do you believe that there is evidence that the flu vaccine prevents serious disease and prevents hospitalization or deaths in children?
I believe that all patients should talk to their doctors.
And so do I. And that's not what I'm asking you. Your qualifications have been much discussed. There is a mountain of evidence about this. Do you believe that there's no evidence that the flu vaccine has efficacy in reducing serious injury or hospitalization? This
wanna
is
be
an
careful
easy
with-
one, doctor. This is an easy one.
I support the CDC's guidance on the flu vaccine, and I will always be working with the CDC, ACIP, and the agencies.
So you believe it is an efficacious vaccine to reduce hospitalization and
Is or is not.
you believe it is?
So as I said, I support the CDC's guidance on the flu
Well,
vaccine.
let me just say, do you think the flu vaccine reduces the risk of hospitalization or serious injury?
I've said
you're
it.
a
I'll repeat
doctor.
it. I believe vaccines save lives. I
The
believe
flu-
they're an
the flu
important
vaccine.
part of public health strategy.
The flu vaccine, does it reduce the risk of injury or
At
hospitalization?
the population level, I certainly think that it does.
Let me introduce for the record, if I can, Mr. Chair, CDC seasonal flu vaccine effectiveness studies dated May 30, 2025 from the CDC that goes into this in some detail.
Without objection.
This is not a hard
I
question.
answered your question.
I know it. After
At a population level, I think
you
it does.
did,
Yes.
3 minutes in, you answered a question that has a very simple yes, or it had a very simple no to the proposition stated by the secretary that there is no evidence. The secretary said there is no evidence that this is effective. And yes, after 3 minutes, you acknowledge that at a population
I
level, you
haven't
would
seen that
disagree with
report.
it.
I have not seen
Yeah,
his-
but you know about the flu vaccine.
If I had a nickel for every time I was misquoted in the media, I'd be a very wealthy woman.
I-
I would like to
I'm-
understand what his comments were.
I'm not asking you about the quote. I'm asking you about something in your remit,
I
the
answered the
effectiveness
question.
of the flu vaccine. All right, let me ask you this. Do you believe it's important to continue to work to reduce youth smoking?
Certainly.
President Trump has said it's a priority to support moms, including supporting families that may need IVF. Do you support that position?
I know the administration is strongly in favor of IVF, and I think people should have access to the best
Right.
quality fertility treatments. And also, my core message has been about how we are missing the mark on our fertility conversation.
I just was asking about IVF.
Yeah,
And
certainly.
finally, the secretary and the president have talked about radical transparency in healthcare. You believe in that?
Yes.
Okay, then I'm very puzzled, not by you, but I'm puzzled about why the administration eliminated the CDC Office on Smoking and Health. It was the only federal entity running the campaign to promote smoking cessation. They eliminated it. They've eliminated whole programs at the CDC working on maternal health, including the center tasked with publishing data on the effectiveness of IVF clinics. They've eliminated the CDC's Freedom of Information Act office. They've repealed the Richardson waiver, thus reducing public participation in the creation of HHS rules. I'm glad that you support smoking cessation. I'm glad you support work on IVF. I'm glad you support radical transparency. I'm puzzled by why the administration doesn't. I yield back.
Senator Hawley.
Thank you very much, Mr. Chairman. Dr. Means, good to see you. Congratulations on your nomination. Congratulations also on the birth of your child. I'm the father of 3. If you're like me, I suspect you've had a tremendous career already, but I suspect maybe that your family will end up being the most significant thing you do. It certainly is for me. I was just thinking I have 3, as I said. My youngest is now 5, Abigail. As I left the house the other day, she had our Labrador, not a very well-behaved dog, I will say. She had our Labrador there in the kitchen, had his paw stretched out and was painting his toenails pink. So anyway, you've got that to look forward to. Congratulations again. But can I just ask you, from a health perspective, can we think about AI just for a second? I want to get your views on this. This is a sort of a cutting edge issue, obviously, that's evolving almost by the day. Data centers. We've got more data centers in this country, I think, than almost anywhere else. They're proliferating. They're needed, we're told, for AI development and so on. My question to you is about the health effect of data centers. Here's what I'm asking. When I am home in Missouri, I get asked a lot now by folks all across the state, maybe especially in rural areas like where I grew up, where there are more and more data centers. They say, we're worried about the health effects. We're worried about contaminants in our water. We're worried about a digital cancer alley. We've had some reports of migraines, vertigo, nausea, chronic sleep disruption from residents, not necessarily people who work at a data center, but just residents in the area. Now, all of this is anecdotal. I haven't seen any studies on it, but that's getting to my question to you. Is this something that we should be looking into? Should we be looking at the health effects, the wellness effects of data centers. I'm talking about these massive, massive centers for residents around. What do you that live around the area? What do you think about this?
First of all, thank you so much for your question, your kind words about family. It's an interesting question, and it's one that I'm so glad you're sharing. It's not one that I've actually thought much about in this specific context, but a core and passion of mine, and what I hope to bring to the role is really advocating for understanding how our environmental exposures are affecting our health. It's been understudied, and there's a huge commitment from the NIH, the Whole Person Health Initiative, and through Dr. Jay Bhattacharya's work to look at how these cumulative environmental exposures are affecting our health. And that's something that I hope to champion in this role. And so this would certainly fit squarely within that category. And I'd love to chat with you more about this if I'm confirmed.
Good. I look forward to that. I'm glad to hear you say that. You have been just an incredible champion for looking at these environmental factors as well as diet and the other things that you've been talking about. And who knows? I mean, correlation is not causation, of course. You're a scientist. This is all what I'm hearing is anecdotal. I think what I read in the press is anecdotal, but maybe we do need a study on it. I mean, there's a sufficient number of these centers, and they're not going to be fewer. There's going to be a lot more everywhere. And the level of concern I hear from working people, these are just normal people. They're showing up to work. They're trying to raise their families, and they're concerned for their health. You know, there are concerns about costs and so forth, but just putting those aside, they're concerned about their health. And I don't know what to tell them because I'm not a physician, I'm not a scientist, but I do think maybe the time has come to say, well, we're going to take this seriously. I mean, we'll look at it and we'll figure out what the truth is, and we'll figure out if there are things that we need to do to protect the health of our folks. So I'm glad to hear you say that you would make that a priority, and I look forward to working with you on that. Can I introduce you here in just the few seconds that I have remaining, 90 seconds or so, to a young man whose name was Adam Rain. I think we may have a poster of him behind me. Adam was 16 years old when he was groomed by an AI chatbot into committing suicide. I think, do we have, yeah, there he is. Adam was just an incredible kid. I've gotten to know his parents. He was a rock star athlete. He was a terrific student. And he started using an AI chatbot, ChatGPT in this case. It's all a matter of public record. He started using a chatbot to do homework. And over time, this chatbot introduced him to the concept of self-harm. He tried to commit suicide multiple times. The chatbot told him every time, don't tell your parents. He didn't. He's very close to his parents before this, I should say. I've met them. They're wonderful people. They've testified. Eventually, the chatbot instructed him how to take his own life, and he did it using precisely the method that the chatbot recommended. Now, I'm sad to say I've talked with too many parents whose stories parallel that one. My question to you is it time to study the effect of AI chatbot companions for minor children? Adam was 16. You know, he's not even a college student yet. He's a kid. Bright kid, great kid, but still a kid. Is it time to study the effects when it comes to mental health and wellness on these AI chatbot companions for minors?
And please be quick with your answer because
Sure.
we're running late.
Yeah, well, it's obviously a complex question and a tragic story that you're sharing, and especially hits so hard as a new mother. I think that you and I are in complete alignment that children's health and protecting minors is of paramount importance. I think a country that doesn't protect its children, has gone off course, and it's a top priority of mine to do everything that we can to make sure children are healthy and safe.
Good. I look forward to working with you on this. Thank you, Mr. Chairman.
Senator Also Brooks.
Thank you so much, Chair Cassidy, for hosting today's hearing. Dr. Means, welcome. Thank you so much for being at this hearing, and congratulations again on your beautiful, beautiful baby. I want to first begin by the places where we agree. The industry, you agree that industry should not have undue influence over our health policies. In fact, you have written that when pharmaceutical companies have a direct line to network television through advertising, and I quote, you say, they can have influence over what messages are emphasized on the news and what is deemed misinformation or truth. Now, can you confirm that those are your words?
That sounds like something I would say.
I'm sorry?
That sounds like something I would say.
Okay, perfect. And I also want to confirm again that you have been compensated. Have you ever been compensated for platforming, spotlighting, or highlighting companies in your newsletters or podcast appearances?
Yes.
Okay, so for example,
podcast, but in my newsletter, I've had newsletter sponsors for my newsletter, yes.
okay. For example, Energy Bits. Have you received compensation from a company called Energy Bits?
Yes.
Okay, and in your newsletter, the very same one where you rail out against pharmaceutical advertising, you acknowledge that Energy Bits sponsored your newsletters. And I wonder, were you aware that the Better Business Bureau found that that company, Energy Bits, failed to provide substantiation for health-related and environmental claims and recommended that it discontinue doing so?
Senator Alston-Brooks, I take conflicts very seriously. I've worked diligently with the Office of Government Ethics to make sure we've looked at all potential conflicts of interest, have signed a letter, had been cleared, and have signed a letter in stating my commitment to divestments. And of course, during my time, if I am confirmed in office, I would take no money from any company.
Let me, Dr. Means, let me just add a little bit more here. I know the time is tolling. Were you aware that this same company was served notice under California's Proposition 65 law alleging that their products contain lead above the allowable levels? Were you aware of that?
Again, I just want to reiterate, in this office, I will not be taking any financial compensation from any companies. I will be complying with the Office of Government Ethics thoroughly before, during, and after my time in office, and I'm very committed to that.
Okay, let me ask you about another company. Have you ever received compensation from a company called Peak?
Yes.
Okay, and in your newsletter number 33, you acknowledge that Peak has sponsored you. Now, were you aware that this company was served notice under California's Proposition 65 for containing and failing to disclose that lead above the allowable amounts, a carcinogen and reproductive toxin, was present?
I just want to repeat, I've worked with the Office of Government Ethics. I'm not going to be taking any
Okay,
financial
but we're talking about just the
compensation.
ones you've already, so this is an
We're talking
ethics.
about conflicts.
Mhm.
And I have been cleared by the Office of Government Ethics through an exhaustive process. I have signed a letter that I will be fully compliant. And this is before, during, and after the term. I take it very seriously, and I'll work closely with them to make sure there are no conflicts.
The point here is that you've received compensation from these companies, including Daily Harvest, where this company was subject to an investigation by the Food and Drug Administration after hundreds became seriously ill after consuming the product. And these are companies that you have received money from. They've been investigated, and you are railing out against pharmaceutical companies that you say are advertising these products that mislead the public, and yet you've received compensation from companies, and you've promoted them in your newsletter, and you're doing the same thing the pharmaceutical companies are doing by advertising and influencing people for these products that have been deemed to be unsafe for the public. Now, let me just move on as well to vaccinations. I want to just, you tweeted that you believe the hepatitis B vaccine at birth is a crime. That is what you tweeted. Do you recall tweeting that?
That is not the full tweet.
I actually do have the tweet. I can provide it for you. I have a copy of it here where you say that vaccinating, that you believe the hepatitis B vaccine is a crime. And I wonder if you believe that, how is it that vaccinating children against hepatitis could be a crime?
I support vaccines. I believe vaccines save lives. I believe they're a key part of our public health strategy. I also believe that this administration is committing to making sure we have the safest vaccine schedule in the world, and that we are continually studying the vaccine schedule, vaccine injuries, making sure we're eradicating conflicts of interest in vaccine research and doing gold standard science on vaccines. These are all things that I support. And I think there's a nuanced conversation that American families are looking to have about shared clinical decision-making with their doctors about specific vaccines that their children may not be as seriously at risk for. And I think that that is the nature and the thrust of my comments.
Well, let me just follow. I know my time has expired. You have spoke on this panel about neurotoxin metals and vaccinations, yet you have promoted through a brief research. Okay, just this last sentence here. You've through a brief search of the products that you've made money off of in your newsletters, many of them have been found to contain the same neurotoxins that you claim are in these vaccinations. I yield. Thank you.
Thank you, Mr. Chairman. Dr. Means, welcome to the committee here. I'm going to stick with vaccines here because I am on. I'm red. Is it better? Better? Yeah. Just too far away. Sorry about that. Sticking with vaccines, you've stated that there is, quote, growing evidence that the total burden of the current extreme and growing vaccine schedule is causing health declines in vulnerable children. And so I've heard your comments to several of my colleagues here today. So I want to drill down more specifically to the hepatitis B vaccine. My state of Alaska has had a very long history with this. Including early childhood immunization campaigns that were targeted specifically to Alaska Native communities. We were seeing some just really startling issues with regards to liver disease in Native children. And so it was a pilot project decades ago that allowed for critical timely vaccinations for these Native children in the outlying areas. It made a remarkable difference in Alaska, and I think other states, other countries look to that as an example. You have expressed the skepticism about the Hep B vaccine for newborns, and I need to try to understand your thinking on that, given the medical consensus that this vaccine prevents this serious liver disease and liver cancer, that we, again, were able to demonstrate in real time, real life, with that recommendation. And now the view that you seem to be taking on this is it is not necessary for newborn.
Thank you, Senator Murkowski, for being willing to want to clarify this with me, and also thank you for meeting with me. I really enjoyed our conversation in October with you and your staff. I think the concerns and comments that you're sharing, I think they're incompletely representing my views, and so I'll take the opportunity to share. This is an effective vaccine. I think it's a very important vaccine, and I think it's obviously Senator Cassidy knows better than anyone, given his work. This is a vaccine that has saved thousands, millions of lives. I don't know the exact number, but I do think that this administration is committed to making sure we have the safest vaccine schedule, and that parents have the opportunity to have shared clinical decision-making on specific vaccines with their doctor so they can make the best decisions for their family. This is not a condemnation of the vaccine generally, which I am very supportive of. However, I do believe that the thrust towards parents wanting to have the ability to have shared clinical decision-making with their doctor is important when there are conditions like hepatitis B where there's differential risk amongst different populations.
So you have said that the Hep B vaccine is, you stated this in response to a question on a TV show, is for a sexually transmitted disease and an IV drug user disease, which of course babies are not going to be exposed to. And one of the things that we have certainly seen with Hep B, recognizing that it's this blood-borne pathogen, 100 times more infectious than HIV, not just contracted through sexual contact or drug use. In Western Alaska, where we see Hep B as endemic, we find that it's being spread through mosquito bites, where a child is itching an arm, ordinary household community contact, whether it's sharing food, toothbrushes, and minor injuries. And so this is where many in my state are looking at this and saying, we have been able to turn the corner on this. We're no longer seeing children with liver cancer, with this liver disease, and it is because the hepatitis B vaccine has been made available to them at birth. And so my hope is that as you are communicating the value of childhood vaccine, that demonstrated positive results of vaccines just like this would be communicated, and not just everybody needs to consult with their doctor. But if you're an Alaska Native population that has been systematically impacted in a way that we've now seen a marked difference. It seems to me that's where you should be directing it. I'm well out of time, sir.
Thank you.
Thank you.
Senator Hickenlooper.
Ms. Means, congratulations on your birth. As I know from 2 experiences, that is about the most magical time you can ever have. We know that many Americans struggle with issues around infertility. Medical intervention often is necessary. According to the American College of Obstetrics and Gynecology, by the age of 30, fertility in women starts to decline. And gets more rapid. That rate of decline gets more rapid throughout the decade. For families like mine, where a childbirth would have been impossible without IVF, I think it's potentially damaging to widely spread a message that if only we made lifestyle changes, we too could conceive naturally. I think that the people that are struggling with infertility sometimes feel that if they only made lifestyle changes, the world would open up. And I guess my question then is, how much time should a woman of childbearing age take to self-reverse a fertility struggle that may ultimately serve as further setback to them growing their family? And I, again, say this as someone who we did use IVF, as you're aware, and it was a transformational.
Right.
That wouldn't have been possible without that. So how long should people wait before making that decision?
Thank you, Senator, for this very thoughtful question, and also for meeting with me in October. I, of course, can't answer for a specific time period that someone should wait. But the broader message, which is I think one that we probably agree on, is that the American people deserve to, and I think want to, have information from medical authorities about what is possible and what the evidence shows in terms of what environmental factors are affecting these really important issues in our life, like fertility. Like we've talked about earlier, infertility is going up about 1% a year in both men and women, male and female infertility. And the key medical conditions that are causing infertility, we know are lifestyle related. Certainly that does not mean that all infertility cases can be reversed by lifestyle changes. And also, the onus is on our medical authorities to make sure Americans are seeing that information clearly and loudly and in an empowered way, and that we then use policy and medical education to make systemic changes that make those choices easier, more accessible, and affordable for Americans. And that's really my message. Patients deserve to know what the data is showing, and not just a myopic view on technological or medical or surgical interventions. They deserve to know the breadth of the spectrum. And from working with thousands and thousands of both levels members and also in my clinical practice, I believe that people don't feel discouraged by understanding what the evidence-based levers are for how they can impact their own health. I think they're looking for that right now, and it's a yes and answer. I think IVF is miraculous. I think it should be widely accessible. And with that said, I also think we need to give patients the best public health information about what is impacting these conditions that are plaguing our population.
Let me switch tack here and talk a little bit about autism, because obviously I don't think we definitively know what causes autism. I think we agree on that, and certainly I applaud any fact-based effort to get a better understanding of that diagnosis. You stated that the cause of autism is very likely to be multifactorial, and anyone who claims to believe that it can be just only one factor is mistaken. So I guess the question is, are those who believe autism is singularly caused by vaccines, including some of those currently serving at the Department of Health and Human Services, by that calculus, are they incorrect?
I can't speak for every person who's made a comment about autism and vaccines. I know that people are in pain looking at the childhood chronic disease epidemic and the rising rate of childhood neurodevelopmental diseases, and they're looking for answers. And I think that I certainly can't speak for anyone who's spoken out about vaccines and autism. However, I would assume that most people understand that health is, there's multifarious things that impact every medical condition, and are trying to understand if there's a contribution from a significant number of medications that our children are getting to this disease. You know, I'm strongly supportive of the research that the administration is, or the grants that the administration has recently enacted, I believe for about $50 million to study root causes of autism and specifically environmental factors. And I think we should all look forward to the results of those studies, and hopefully we can help children through that.
I appreciate that, and I look forward to that science being the North Star of those investigations.
Yes.
Thank you.
Thank you.
Senator Markey.
Thank you. Dr. Means, thank you for being here and congratulations. You have spoken extensively, including earlier in this hearing, about the root causes of chronic diseases and the harmful impacts of unhealthy foods and environmental toxins. And this is an area where you and I may have some common ground. Over a decade ago, I called on the EPA to review the safety of pesticides and their link to cancer. So yes or no, Dr. Means, do you agree with the scientific research that glyphosate, one of the key ingredients of the most widely used weed killer Roundup, is harmful to humans?
I certainly have significant concerns about many of the environmental chemicals that are used in our agriculture system, of which glyphosate is one of them. And I think they need to be significantly more robustly studied so that we can understand the cumulative impact on health. And that's a passion of mine.
Yeah, according to your blog post of August 19th, 2024, and I have this here, you wrote, quote, "The World Health Organization has explicitly stated that glyphosate damages our DNA and probably causes cancer." So I request unanimous consent to
Without objection.
submit the blog post. Thank you. You also wrote that there are, quote, "billions of people impacted by the sublethal chronic impacts." These are toxic substances, you wrote. So I agree with your concerns about glyphosate. We should prioritize protecting people from harmful chemicals, not pushing them. Yet last week, Donald Trump signed an executive order to promote production of glyphosate-based herbicides. Just a few months before, the Trump administration filed a brief with the Supreme Court arguing that Monsanto, one of the main producers of glyphosate, should be shielded from lawsuits from Americans who develop cancers from being exposed to glyphosate containing Roundup, which is a weed killer. Instead of fighting for families with cancer, the Trump administration is fighting against them. So again, back to you. Yes or no, do you think President Trump's executive order promoting the production of glyphosate, which you yourself have said likely causes cancer, will put American families' health at risk?
Senator Markey, you and I both know that these issues around agriculture and health are extremely complex and are affecting farmers, consumers, food producers, food accessibility. My understanding of the executive order is that the thrust of this has to do with national security and decreased resilience and reliance on foreign countries for tools that farmers are currently using right now.
But these are these are cancer-inducing chemicals. According to your own statements.
We must, as a country, move away from using toxic inputs in our food supply, and we must study these chemicals more to understand their effects. I am very gravely concerned about the health impacts of these chemicals.
I understand that. Doctor, I'm just trying to help you to agree with yourself. You've already said it in the past, but Trump is contradicting you.
Our food system is dependent currently on these chemicals. There is a good faith movement towards moving our food system towards regenerative agriculture and precision application of pesticides. I believe in good faith that is happening within this administration. I do also believe that we must do that for
It's
human
not
health.
good faith. He's immunizing. He's arguing that there should be an immunization of Monsanto
Yeah,
against any
and
lawsuits. That's not good faith. That's just siding with the chemical manufacturing company that is in fact causing the cancers. So don't you think it does put families at risk if these chemicals are in the system? That's been your position historically.
I think there's grave issues with these chemicals. I think that we are in a very complicated moment for agriculture and food. We cannot overturn the entire agriculture system overnight. That would hurt farmers. It would hurt food prices. This is a national security
That's not what the Trump
decision.
administration. That's not what the Trump administration.
And as
said.
a physician and as the Surgeon General, my focus would be on making sure that we are protecting American consumers and their health and making sure that we are having transparent, honest conversations about these
I'm
chemicals.
disappointed to see you back away from your efforts.
I am not in any way backing away from this issue. It is a core passion of my life.
Okay, Secretary Kennedy has already backed away from his prior statements that glyphosate is a carcinogen and a, quote, likely culprit behind chronic diseases in the United States. That's a total U-turn.
This administration
on the health risk of glyphosate. Total U-turn by Kennedy, and you're in his agency. Yeah, thank you.
Could I respond, Senator Cassidy? The administration has put down in very clear writing through the MAHA strategy that we are going to study the chemical inputs of our food supply. We are going to make sure American consumers are protected and that we are entering an era where we are going to prioritize helping farmers move to more sustainable farming practices. I think those are all good things. I think it's extremely important both for our planet and our health, and I'm going to be a champion on that issue.
The MAHA movement is not happy with the Trump executive order. Okay, that's the reality. Thank you, Mr. Chairman.
Taking the chairman's prerogative, I've listened obviously to everyone. I have a couple follow-ups. When you speak of shared decision-making as regards immunization, right now the doctor speaks with the mom or the dad as regards should the child be vaccinated. There's nothing like takes the parent out of the room and gives the child the shot. No, we're about to give this, and they discuss it and they give it. Are you speaking about something more than what is currently used?
I think, Senator Cassidy, I think that in our current landscape of our healthcare system, robust, thorough conversations about informed consent
So
are
that
lacking.
should happen. So are you speaking of a formal consent form?
No, I'm speaking of generally that we need to unburden our doctors to make sure we're having conversations that address all parent concerns, that don't shame parents, and that honor the ability to have robust and nuanced conversations about medical decisions for our children.
But that happens. So you're advocating for something different, I think. My pediatricians tell me they routinely have these conversations. Are you advocating for something different than what my pediatricians say they routinely have?
If these pediatricians are doing that, I commend them, and I think that's fantastic. And I think we need to support doctors and our broken medical system.
But are you advocating for something different than the doctor saying, I think your child needs the hepatitis B vaccine? When the child passes through the birth canal, they are exposed to the same secretions that they would be through intercourse. By the way, when they're a teenager, they may have intercourse with someone who's a chronic carrier. Now is the perfect time, and it's safe. Now, would you ask for something more than that? Or I'm not quite clear because it seems as if status quo is not adequate, and that's what I'm trying to understand.
I support the CDC's recommendations on the vaccine schedule.
I get that, but I'm asking you, what I'm trying to get at, are you asking for a formal, informed consent as if somebody's going for bypass surgery or somebody's going for an appendectomy for an immunization?
I'm not necessarily advocating for that. I think that you and I both know from clinical practice that the constraints on doctors are monumental, and many American parents are frustrated by what they feel like is lack of transparency on the issue of vaccines. And I think doing what we can as medical leaders
So what would that be?
It's encouraging a culture shift towards making sure that we're respecting parent questions, choices.
I don't see that culture lacking. And so that's where, when I speak to the pediatricians, they emphasize that they spend a lot of time discussing immunizations.
I spoke to a physician leader of a major medical organization last week who in his morning clinic saw 28 patients. I think you know exactly what I'm talking about, that the physicians are very overburdened.
In that case, I'm sure the nurse extender, the physician extender would be having the conversation. I mean, we both know that there's other ways to communicate. And so I'm not sure I know what you're advocating for, which of course gives pause.
Broadly speaking, I am very supportive of what's been laid out by this administration in regard to vaccines, which is that we want to make sure that for all of our vaccines, we're pursuing gold standard placebo-controlled trials, that we are robustly and transparently studying vaccine injury, that we're making sure that conflicts of interest in any of the research around vaccines are addressed and understood, that post-licensing data is transparent and shared with the American people, and that we work towards a healthcare system where doctors have more time and ability and incentive to spend more time with patients for the sake of both the doctors and the patients. Those are all common sense
Now, the
things that I
secretary
agree
has
with.
suggested that the fact that a pediatrician gets $5 more for vaccinating a child reflects a conflict of interest that would incentivize them to vaccinate a child, and the conflict of interest being pejorative, if you will. Would that kind of outcomes measurement with the aligned incentive to promote immunizations be considered something negative?
Senator Cassidy, I want to just back up and broadly just reassure you that this is not an issue that I intend to complicate or bring an agenda on vaccines. This has not been the core of my issue. As I said, I support the initiatives that the administration is putting forward to hopefully restore trust in public health through increased transparency and through placebo-controlled
And one more
trials.
thing, I'm sorry, and you've made that point. You've presented very well, by the way. Let me just compliment you. It's clear that your concerns about metabolic disease are very important. And by the way, I agree with that totally. Do you agree with the need for universal hepatitis B immunization?
I think right now, any parent in America can walk into their pediatrician's office and get access to the hepatitis B vaccine for their child if they want it. And my understanding is that that all insurers have agreed to continue with cost sharing on that vaccine.
I accept that, but is universal hepatitis B immunization, irrespective of what age the vaccine would be given, is in your mind, is that an important goal?
It is accessible to every American family right
That's
now.
not what I'm asking. Is it an important goal?
I think it is important, an important vaccine. It's a life-saving vaccine. I also think that parents' autonomy and family autonomy.
No one's arguing that, because no one forces the child.
Well, that
No one
universal and parent autonomy, but broadly speaking, I believe that parents want to have a good faith conversation without shame with their doctors about vaccines, and that we need to move toward a medical culture where that's possible. And I genuinely believe that will help restore trust in public health.
One more time.
Right
though.
now, that's not
Everything
the
you
current
say, I
culture of
agree with.
medicine.
But the question is, because we want to support parents, the question is universal hepatitis B immunization an important goal?
I feel like we're going in a semantic loop here.
Okay, but-
Do you want to define for me exactly what you mean by
Should we be
every
promoting-
child in America?
Yeah, should we be promoting to parents that for the long-term safety of your child, she or he should be vaccinated for hepatitis B at some time in their youth?
At some time in their youth, I think that's
I'm sorry?
at some time in their youth, I think that's an important recommendation. Yes.
And okay, so is that to say that you agree that universal hepatitis B immunization is a goal we should be shooting for?
I think there are many parents, and I think the administration question whether this vaccine is necessary for all children on the first day of life. And I think that certainly if we're talking more broadly about promoting universal vaccination in children at some point in childhood, I think that's a worthy goal.
Okay, and I'll just note that among some populations in Hawaii, up to 10% of the folks are chronically infected. And of course, we know that one of those may eventually marry someone who's not. So if they're not immunized and they marry someone who's chronically infected, then you're more likely to have acute infection in the person married to the person who's chronically infected.
Right.
And that's a very Hawaii specific, but it's of course can occur anywhere. Thank you very much for your testimony.
Thank you, Senator Cassidy.
For any senator wishing to ask additional questions for the records will be due 5 p.m. Thursday, February 26th. Thank you again for being here. The committee stands adjourned.